Good afternoon and welcome to this instruction course on peripheral ulcerative keratitis, pearls in management. My name is Virender Sangwan. I work at Dr. Sarauf Charity Eye Hospital in Daryaganj in Delhi, and we would like to share our experience and whatever we know for management of these patients. We have no commercial interest to declare. The co-instructor for this course is Dr. Isha Chaudhary. She is a cornea faculty at Dr. Sarauf Charity Eye Hospital with me. Dr. Somsila Murthy, she is the medical director at Shantilal Sangvi Eye Institute in Bombay, and J.S. Vajrani from Excel Eye Care from Ahmedabad. What you can expect this course, if you see, look at this kind of a video, you can make out clearly that it is not an inflamed eye, and that is why we called it a degeneration, not a active ulcer, because there is no, and when you put the staining, most of these patients would not have any ulceration. Yes, small minority may have inflammatory terians also. On the other hand, sometimes when you do a pterygium surgery, you may find a picture like this, that and this kind of a picture can also cause peripheral ulcerative keratitis, but here it is primarily a ischemic necrosis of the site where pterygium was removed, and there are multiple ways that it clinically presents. Have you seen a patient like this anytime? This is a young female child of 7-8 years old and no history of any trauma. Parents brought that this is a mass growing on the surface, and they brought for the treatment. This was a fistula connecting to the anterior chamber and this conjunctival cyst, and so when I removed, there was some kind of trauma which child did not remember. This is like a healed Moran's ulcer, and why I am saying healed? Because you don't see cellular infiltration, don't see redness, don't see congestion. So therefore, it's very important to clinically decide whether you are dealing with an active disease or inactive disease. This is a very interesting case. I was called to see in emergency clinic in LVP in 2005, and in my usual style, I said, ये तो perforation है, इसको surgery करना है. But can you see what is remarkable about it? Anyone wants to say anything? That again, there is no inflammation, there is no redness, right? So if there is a perforation, why is no ulceration, no redness, no congestion? Very unusual. In patient did not have pain either. And I, at that stage, I was very young. I was just started my career. I also did not know what it is. When I was doing the surgery, patch graft, the feeling of the tissue field was so unusual. I kept saying to my fellow, ये बहुत अजीब सा लग रहा है, कुछ तो गड़बड़ है. Then we sent everything to pathology, and it turned out to be a carcinoma. I will show the rest of the story in my presentation. So when we are saying peripheral ulcerative keratitis, which means essentially this is the definition, that it is a crescent-shaped destructive inflammatory lesion with epithelial defects, with subepithelial infiltrate and a central edge. It can be non-infectious. We will talk details about the clinical presentations. We'll talk about the differential diagnosis. But very important significance of PUK and necrotizing scleritis, especially if the patient has collagen vascular disease of anything. This has a very serious implication. That means it's not only the eye disease, it signifies that there is a possibility of visceral vasculitis, meaning kidney, liver, heart, lungs, they can get affected. So you should not take it lightly. If you don't know how to handle these patients, maybe refer to a rheumatologist and say that this is very important, that we get to the bottom, that does this patient has any threat to the life. And in literature there is enough evidence, and that is why these patients need systemic immunosuppression. we'll talk about how to differentiate different clinical entities in the differential diagnosis. So our objective of this course is that we will, you'll be able to diagnose common entities of PUK and what is its medical and surgical management, differential diagnosis, immunomodulation, and what is the risk to the life of a patient with PUK. We do not want to have very didactic. Please feel free to ask questions, stop, as much discussion as you want. It's not important what we want to say, it's more important that we answer your questions. So we'll be happy to interact, ask question any stage with any